Hi, everyone, and welcome to this Perspectives podcast, which is produced by Retina International. My name is David Sanchez, and it's a pleasure for me to be here with you. I would like to introduce you to Avril Daly, who is going to present this podcast with me. Hi, Avril.
Hi, David.
Thank you for being with us. And maybe it will be a good idea to tell our listeners when can they listen to this podcast and where.
Sure. Thank you. Thank you, David, for inviting me to participate in these podcasts with you. Retina International has launched a series of podcasts, our Perspectives podcasts, and we're starting this new year, 2025, with a new series of podcasts. And as the name suggests, really, Perspectives is kind of moving a little bit outside of the science that we normally discuss in the context of Retina International. I know our members are really focused on research and innovation to find treatments and cures for forms of retinal blindness. But, we want to hear more about people's understanding of their conditions from the perspective of them as patients living with the disease, as family members living with the disease, but also from people who are providing care, clinicians, psychotherapists, from our innovators, our scientists, our researchers who are really working hard to find solutions for the conditions that so many are living with. So really, that's what this is all about. It's about to hear the real lived experience of all of the stakeholders involved in this community. And today is the first of this year. So that's really what we're all about here today.
Yeah, okay, wonderful. We remind our listeners that we will try to publish monthly a new episode of this podcast and that they can find it in the main platforms of podcast and as well in our YouTube channel. So I think it's wonderful and it's a wonderful idea, this podcast. So maybe we can talk about the topic for today, mental health.
Yeah.
I think
Yes.
it's a really important topic, maybe in fashion. And before presenting our guest, maybe Avril, you can tell us what about or why is important mental health and it is in fashion.
Yeah, and I think the term you use, fashion, it's an interesting term. You're quite right. I think the fact is that we hear a lot about mental health these days. I think it's important to say, considering that we have a global audience, that there are some countries where the issue of mental health is prioritized in the context of healthcare. And in the daily discourse, people discuss mental health a lot. And we know that certainly in the United States, in Canada, in Europe to a large degree, there are policies around ensuring that there is mental health care for the general public. But when you scratch the surface and you look underneath, it's a lot of talk, but what does it actually mean? What does it mean to us as individuals? And David and I were talking about this podcast, and we're conscious that at the end of February, we have Rare Disease Day. And we celebrate Rare Disease Day. We mark it as an opportunity for those of us living with rare eye diseases to really talk about the issues that are pertinent, that are important to us. And really interestingly, last year at the Retina International World Congress, and you remember this, David, there was a session on access to diagnosis and the impact of diagnosis, which led to a very vibrant conversation with 500 people in a room, if you want to call it a conversation, about the importance of mental health and the fact that our member organizations, but also those that are involved in our clinical community, our scientific and medical advisory board, were very engaged in the discussion and found it incredibly interesting listening to the different experiences that people have had, not only in the context of diagnosis, but also, in their own experience of living with a degenerative eye disease. And so myself and the team at Retina International and our board of directors had long been discussing the possibility of establishing a study to really look at the issues as they relate to our community. And so we are working with our community right now to develop that study, which will be going live in the summer. And we just kind of wanted to talk a little bit more about this in general terms. And so that's why we're really discussing it today as part of our marking of World Retina Day.
Yeah, because mental health is related with a lot of different conditions, and it is close related with eye conditions as well, because you know, especially when we talk about IRDs, when we have a degeneration of our retina, and mental health is impacted by this for sure. And Avril, maybe it's time to introduce our guest. Welcome
Yes.
to Matt Johnson. Hi, Matt.
Hi, David. Thanks for inviting me on the podcast.
Welcome to be here with us. Maybe, Avril, you can tell us a brief about Matt for those who
sure.
don't know him.
Well, yes, and thank you, Matt, very much for joining us today. Matt Johnson is the mental health lead and healthcare advisor with the European Organisation for Rare Diseases, and has worked closely with many of our colleagues in Europe over the years, because Matt has had quite a significant role in the development of European reference networks for rare diseases, and has been instrumental in helping us in the whole rare eye space. But Matt, maybe I might hand over to yourself to introduce yourself now, because I know your role has evolved, particularly in this area of mental health recently.
Thanks, Avril. So I would describe myself as an advocate, and I've been an advocate active on a European level, working with EURORDIS for about 11 years now. Before that, I worked in the health service in the UK as a manager and a commissioner. And it was only when I joined EURORDIS that I realised that when I was in the health service that I was also an advocate, because it's important to connect with people living with a condition, to understand their needs. And what really struck me, because my background in health was in mental health, and when working in EURORDIS for the last 10, 11 years, and working with patient groups across all the different thematic areas, including rare eye conditions, I kept on hearing about the challenges around mental health, and it was a common need, but it was very much overlooked and overshadowed by those other medical complexities everyone looks for, right? Finding a diagnosis, finding a cure, pushing research. But you know, when we're not doing those things, we're alone, and it's the psychological impact of the rare disease journey comes home. So, you know, I feel really privileged and lucky to get to connect our community together on mental health, and prioritize that and say your mental health matters, and let's not be alone. Let's come together and let's learn from each other and share and support each other.
Absolutely. Thank you. No, we really appreciate you being part of this, particularly on our first of the year, and particularly for our Rare Disease Day podcast. So, David, over to you.
Well, as I previously said, Matt, it seems that mental health is in fashion. You know, I don't know if it is well said or not. You know, but what do we refer to when we talk about mental health? Because it's really a huge topic, maybe.
So I like to, we normally talk about mental health, and we all have different perceptions of what it is. And it's normally something with negative connotations, and there's stigma attached. But I always like to go back to how the WHO, the World Health Organization, defines mental health, because I think it encapsulates a more positive perspective. And they talk about mental health being a state of mental well-being that enables people to cope with those life stresses, for people to realize their abilities, to learn well, to live well, and to contribute to the community. So mental health is actually a positive thing, and it's something which can be affected by lots of different things which are external to us. So for people living with a rare eye condition, or more broadly with a rare condition, when you get a diagnosis, you're thrown onto a rare disease journey, which has uncertainties and is paved with uncertainties and can be quite traumatic as well. And you're having to live in this quite difficult environment and situation where people don't know what's going on, and you're struggling to get answers, and there's not much clarity about the future. So our mental health and well-being is impacted by is a symptom really of living a difficult life, and there's things that we can do externally which can really help us going through that journey to rise to the challenge and be empowered to deal with these challenges in the best way and minimize those stresses and strains which are associated with it. So mental health for me is a very positive thing. And I think in some communities, we have a global population connecting on this podcast and listening. In some communities, it's, the stigma around mental health is really prevalent. So if you want to, for a moment, just move that to one side, the term mental health, and say, what about quality of life? How can we optimize our quality of life when living with a rare eye condition? And when we talk in those terms, it's more accessible to people. People are more ready to say, well, actually, it's really stressful, all this. And what we shouldn't do is medicalize what is actually a very natural response to a very difficult situation. Being diagnosed with a rare eye condition and having, being told it's a degenerative one, it would be unnatural to be okay with that. It is absolutely a natural reaction to be stressed and unsure and to be worried. And we shouldn't medicalize that and say it's a mental health issue as such. We should look at it in a more positive way and say, actually, that's a really natural reaction to a very difficult situation. And how best can we support those individuals at that point in time to make the steps forward?
So it's from your words, it's close related with rare conditions and with rare A conditions as well. It's link, I think.
It sounds like coping. You're talking about mental health it's the coping when you hear a diagnosis and you're pushed into, as you say, an unnatural situation that you don't anticipate. And so you're trying to process information which is stressful. And so therefore it's automatic that people say, oh, that's going to affect your head. It's going to affect your mental health. So that's kind of the terminologies we use, isn't it?
So if we change the perspective on looking at this as being about the head and more we're going through a difficult situation, exactly. The reason why mental health has become a fashion in a way in policy terms is COVID was very indiscriminate and with everyone around the world. And we saw that the different communities were disproportionately affected by those social distancing and isolation measures. And so coming out of COVID, we have a bit of a hangover, let's say, of people suffering from the impact of that external thing called COVID and the policies which were put in place to manage it. So with rare diseases, it's a similar situation. We have things which we call them protection factors or risk factors. And when we're thrown into a rare disease pathway, the risk factors are really amplified and they can cause poorer mental health and well-being, such as it can be a bit of a traumatic experience. There's poor physical health. You living with uncertainty, which causes stress and anxiety. It could impact on financial independence, social isolation, and prejudice. All those things are risk factors which, when you are exposed to them, increases your mental health, poorer mental health. But there's a range of positive or protection factors which are external as well. So when you get diagnosed with a rare eye condition and you connect with a community like this, all of a sudden you're connected. You're with people who understand the condition or conditions. So that's a protection factor. You're not isolated. It enables you to build self-esteem and self-acceptance. You can optimize your support system. Good physical health is actually a protection factor with good mental health. So there's different things which we can look at, which are through a different lens, as it were, around mental health, our mental health, which can that we are affected by these external forces, which can happen on a day-to-day basis. It's very fluctuating how you feel in the morning compared with at the end of the day, how the day is gone. But we need to, the rare disease pathway is sort of paved with these risk factors like increased social isolation and lack of support, traumatic events like being given a diagnosis and it not being communicated in the right way. But we can also change the dynamic, that pathway to be more supportive, to mitigate those negative impacts on your well-being, and to optimize you to be able to cope, to build your resilience. And so mental health is a very dynamic thing, and it's integrated with your physical health as well, but also integrated with the environment you're in, the social networks you're in, how you are at work and whether you're able to work. So it's a very complex thing.
And I was going to ask you, sorry, go ahead, David. Go ahead.
Oh, only one question. So the mental health policies must be related with your environment and must be related as well with if you are living, for example, with a rare condition. All these kind of things you have to take, our politicians have to take them in account in order to implement these mental health policies.
If we approach policy looking at mental health as a purely biomedical, from the biomedical perspective, i.e. it's about providing mental health support and treatments, etc., we will not eradicate mental health. We will not reduce it. We'll fall short of achieving that goal. And in many ways, coming out of COVID, I want to say the European Commission had what I call an epiphany. They had a moment of clarity where they realized that to address mental health, it needs to be across all policy areas. It's about looking at the economic policies. It's looking at transportation. It's looking at employment, social care, housing. And the challenge really is for the Commission to deliver on, the European Commission I'm talking about here, for it to deliver on improving the mental health and well-being of the EU citizens. We have to have all those different departments at the Commission working together to addressing those needs, because as soon as you, like with COVID, there was certain policy decisions made there which had a big impact on the whole of society. We have to have a joined up policy in this way.
And that's what I was going to ask you, actually, David. It took the words out of my mouth there. It's like, from a policy perspective, this is why they arrived at this conclusion. They saw the value, the impact of, let's just use the broad term of mental health. You know, it's really interesting for us listening to this as people living with rare eye disease and representing advocates who are living with rare eye disease. And I mean, you know, the community that we represent are not, let's just say, ill or sick in the terms that, you know, they're well generally, have, you know, but the real impact is in, you know, living with a degenerative condition that causes a disability. And it's interesting when you talk about, you know, the policies have to cross-cut all aspects of society, because our challenge is not necessarily in our challenge with healthcare and access to healthcare per se, or going in and out to hospital environments. It's actually in living your life. So it affects education, it affects employment, it affects transportation, it affects all of these things. The stress that somebody experiences when they are living with limited vision or a degenerative condition that's causing them to lose their vision all the time. So it's constantly evolving. It's a dynamic situation. And so when someone gets up in the morning, you know, they have to constantly worry about how they're going to get to where they go, and are they going to get home safely? And not only do they have to be concerned with that, but those that care for them in the family home, their loved ones, have to worry about that too. So we hear from our community that, you know, it's not just a case of the individual that's affected, but it really is, you know, a broader effect. It affects the family, it affects the friendships, it affects the social environments that people live in. So that's why it's interesting to hear you say that this is quite a broad, it's not just an issue of we're going to do this through health, you know, so that's interesting. How are they going to do that, Matt? I suppose is the big question.
Well, I think it's when we look at this, people can be in different. There's a number of vulnerable situations people can be in, and so we know that young people and children live in a vulnerable situation because of the impact of digitalization of society and a number of other things. When you look at rare conditions, it's overlaid with multiple vulnerable situations. Generally, it affects children majority of the time, living with a visible, invisible difference or disability. It can be that there's multiple comorbidities. There can be risk of cancers, which is also another one. So we have our community live with the accumulation of being exposed at the interface of all these different vulnerable situations, and it makes it more complex. But I just wanted to highlight that so we need to understand our community's needs. We need to understand the needs of people living with a rare eye condition and see what support can be tailored to them. But not just to them, but to their families as well. Because as you rightly said, Avril, you know, the impact of a rare condition, yes, it's on an individual, but it's also on a whole family. And what we know is, and sort of caregivers, partners, parents of someone with a rare condition, generally they try to not focus on their well-being. They want to dedicate any time that when they go to a medical center, any time needs to be focused on addressing the needs of the person living with the rare disease, and they sort of put themselves back, as it were. And what we know is that when the individual who is caring, or the partner, or the parents, when we support them and optimize their well-being and quality of life, that has a direct impact on the person living with the rare disease. The quality of life of an individual living with the rare disease is so much more, is increased, because your main support, you know, is your partner or your parents, and if they're not doing well, it sort of undermines the stability and the, you know, that the resources of the family to cope. So we need to make sure that first and foremost, whether you're a person with a rare eye condition, or a partner, a parent, or a caregiver, that you need to think about your well-being first and make sure you get the support you need, because that ultimately optimizes the quality of life of the person living with a rare condition. So I think we should not forget that, and I think it's generally the opposite.
And Matt, you work in the European Union space. What's been done in relation to mental health and policy? What have they done?
So the European Commission developed something called a comprehensive approach to mental health. Their policy was, they have different terms, but it was called a communication, but it was a policy. And it set out a number of actions and flagship initiatives to address these needs. EURORDIS are a member of Mental Health Europe, which is one of the main advocacy groups in Europe on mental health. And what we try to do is to make visible in the mental health space at European level, we try to make visible people the rare disease needs, because when they talk about mental health policy, they need to meet the needs of all those different communities. And what we tend to do is go, mental health is dealt with over here, rare disease is dealt with over there, social care and disability somewhere else. So we try to make visible the rare disease impact, rare diseases in mental health space. And at a national level, we do the opposite. We want to make visible, because there's lots of rare disease national plans, we want to make visible in those national plans mental health. So we're trying to approach it from two ways. But they do a number of flagship initiatives at a European level, and EURORDIS are, working with different advocacy groups to make sure that the needs of our community are visible. But instead of waiting for changes in policy, we're also taking action ourselves and coming together as a network. We did a call for people to join our mental health partnership network. We did it a couple of years ago, and I was hoping for about 30 people to join. We're about 140 people at the moment. 80 of them are people with lived experience, and the others are clinicians, researchers, and psychologists. It's open for anyone to join, and we come together to see how we can not wait for policy. We aim to influence policy, but we try to also take action now, because I think in our communities there's such brilliant real world experiences we can draw on and cross-fertilize. So we're working on a toolkit, a mental health toolkit for rare diseases, which showcases tools and approaches which maybe the tubular sclerosis community have developed, or a National Alliance in Australia has developed. So we're pulling together all those different tools and showing how different communities can use those tools as well. So yeah, we're doing a number of things on a European level to try and but just to say that the network which I'm talking about is open to people outside the EU. We have people from 9 other countries from outside the EU taking part. So we if anyone wants to get involved, they can.
Wonderful.
And we never most important thing
as you
is for
said,
people to talk about mental health.
Yeah, as you say, it's a global problem.
It's a global effort.
So everybody is welcome to join this action. Avril, there are a lot of interesting things related with this topic. I'm sure we will need a new one episode.
We will need to.
about...
I mean, I'm just thinking the same thing, I think, as yourself, David. It's like this has been really helpful, Matt, to sort of think about things in policy terms. And the fact that mental health is a very specific issue depending on the individual and what they're living with and what their family is living with. And it's great to hear that the initiatives that you're doing in Europe are open to others, because we often, as a global organization, are approached by countries where there isn't an initiative and they want to start, they want to learn, to understand how something like this could be advocated for at a local level. And as I said as well, and I think it's important to say that we are doing a mental health study. Well, it's very focused in the first instance on inherited retinal degenerations and other forms of rare eye disease, to really understand that what is that lived experience, and so that we're working on surveys and focus groups with our membership at the moment. And this study will be over 3 years. So I would say to anybody who's listening to us today, regardless of where you are, be really interested to hear more about what's happening in the context of mental health where you live. And if there was a way in which we can support through Retina International, the work that you're doing, and also put you in touch with people like Matt, who's working globally across all disease areas to try to highlight this really important issue. But I think from our perspective, it'd be great to explore this a little further, perhaps, David, and maybe talk to some people in our own community about their experience, or maybe what's happening outside of Europe. So it's a great opportunity, Matt, for us to get started. And I really appreciate you taking the time today to be with us, to kick off some thought processes in our community that I think are there, but we need to develop a little more. So really appreciate that, David.
Matt,
just wanted to follow on. The one thing I've learned, because I worked globally with Rare Diseases International for quite a bit, our learning, we know more when we learn from each other and cross-fertilization. So learning from different countries around the world, it's a two-way thing. So the work you're doing in Retina International on this study, I'm looking to you to learn about how this is impacting your community, and that can really enrich the work and the advocacy which we're doing. So it's a two-way street in terms of learning. I just wanted to do a shout out. And I'm inviting your community to hijack our rare barometer survey, which will be launched this year on mental health and well-being, because that's a global survey, and we present the report in data in for specific conditions and for countries, so you'll be able to get the results of that. So you're doing a survey as well, but there's the more data you have on this, so I invite you to hijack that and get you the results.
That's great.
Wonderful.
Thanks for that. I know the team will be very excited to hear that that's happening. So it's good to know.
Wonderful. And thank you very much, Matt. I think to address something, the first, we need to know about it, and knowledge, it's something really important, and these kind of studies, I think they are really helpful. So I'm sure Retina International will share information about this study, and it's time to finish this episode, Matt. It's been a pleasure, a wonderful pleasure for us having you here with us. Thank you very much for joining your knowledge, your experience, your work, and thank you for all of this.
Thank you, David,
Matt.
and Avril.
Appreciate it. Thanks a lot.
Avril, it's time to finish. Maybe we should tell our listeners that if they have seen this episode, if they like it, to give we ask them to give us a like in their social media, to share in their social media this episode, in order to get to many people as possible. And it's been a pleasure have this kind of conversations and to disseminate this really important information. And maybe what we should do right now, it will be invite people to our next episode. For that, if they subscribe to our podcast, to Perspectives podcast, they will receive a notification anytime we will publish a new episode. So it will be really easy for them to listen our podcasts, and it is free. This is something important. And we will provide them information about how to subscribe to our podcast, where they can find it. And I think next month we will be here again with another guest talking about another, for sure, really interesting topic. And since then, thank you to everybody, and see you next Perspectives episode.